Welcome to New Future's 2022 Legislative Wrap-Up Report of the Priority Health and Wellness Bills, where we will tell you about the bills that we supported, opposed, and tracked. This was the second session of the legislative term, and the pandemic continued to be a challenge for policymakers as well as for advocates. But we all work to adapt to a new way of doing things. So today we'll share the work that all of us have worked on this past year. Let's get started with the campaign for a healthy New Hampshire.
Hello, everybody. My name is Kate Fry. I'm the Vice President of Advocacy at New Futures, and I'm the first one up to bat to talk to you about our campaign priority this year, which was a campaign for a healthy New Hampshire. And we focused on this because as the pandemic continued to devastate Granite State communities, lawmakers were considering almost 40 bills that, if were passed, would undermine our current public health infrastructure like we've never seen before. And so we, together at New Futures, through this campaign and working with several other organizations, we really wanted to make sure we could still protect and strengthen our public health system. And so this is why we focused on this particular campaign. Our goals were to improve vaccine access, strengthen healthcare data and delivery, promote public health measures, and support the long-term health of New Hampshire. So as I said, there were over 40 bills that were introduced. Almost all would have a detrimental effect on vaccine access and public health infrastructure. There were, as I said, several organizations who were very concerned about these bills. So we were very pleased to be able to work with a larger coalition. However, New Futures focused on bills that really had an impact to the larger public health schematica and infrastructure, and also would really challenge proven public health policies that we've had in place for years, long before the pandemic. So I'll just review the bills that we really focused on in this campaign, where and how they turned out. And I will say ahead of time that we were very, very successful with this campaign. I think far more than we expected. And all of that had to do with advocates and other organizations who worked so hard on this issue. So the first bill that we were focused on was House Bill 1035. And this really had to do with adding a philosophical or conscientious exemption to school vaccine mandates. So again, COVID aside, this didn't focus on COVID. This focused on the childhood vaccines every child is expected to receive before they enter school. And we all know that these vaccines have saved lives over many years and eradicated many diseases. And so we're talking polio, measles, mumps, and vaccines related to diseases like that. New Hampshire is a very, very successful childhood vaccine program, some of the highest rates in the country. What this bill would have done was to add a conscientious or philosophical exemption. There's also already a religious and medical exemption for somebody to say they can't have those vaccines for that reason. But anytime you add a philosophical vaccination or philosophical exemption, it just opens the door for more people to choose not to get vaccines. What happens then, obviously, is our herd immunity decreases and these diseases start to increase. And we've seen that in parts of the state where there's a low vaccination rates. So we were really fortunate with this bill. Even though we did present the issues in the House of Representatives to the House Health and Human Services Committee, and really early on they heard those concerns. So it was amended to be really of an issue we're not as concerned about, just to take out the notary needed for a religious exemption. So pretty early on, this is amended in a form that New Futures was fine with, was neutral with, and we really viewed this as a huge success. House Bill 1210 had more challenges throughout the whole session, and this was similar to 1035, but it really targeted adult vaccinations. It would allow a conscientious or philosophical exemption for really any employer or business that receive federal funds, and also the post-secondary institutions in the state. This again was something that was of concern because as soon as you open up the door for folks to receive an exemption like this, your rates go down. And so when we're talking about healthcare organizations, colleges where you have really close quarters and the need to really make sure that people have vaccines, this would have weakened those efforts. So even though it passed the House, the Senate did choose to send it to interim study. So this was another success. House Bill 1606 makes the state vaccine registry an opt-in program. This was another bill we were concerned about. Anytime you have a registry or a database, opt-out is really the way to go. That's how our vaccine registry currently works. An opt-in program just makes it much more difficult to get effective have an effective tool in the toolbox. And so this did pass the House originally in a much more detrimental form that really would have been very problematic. It would have been an opt-in for every single vaccine every time someone goes to get one. But in the Senate was amended to make it kind of an opt-in, opt-out model. It's still very concerning to us. It has a fiscal note of about $1 million, and there's no appropriation for that. And it would greatly weaken an already effective program. So this is one that we really are asking for further advocacy to the governor's office to ask him to veto the bill. And then on the Senate side, we had two bills that we were watching closely. SB 288 would have prohibited requiring COVID-19 vaccinations at schools or childcare agencies. As we know right now, they are not required. The department has not said that they would be required anytime soon. So we felt that this was a preemptive action that just didn't make a lot of sense at this point. We were fortunate that when it did pass the Senate, it was in an amended form that we were okay with, and then that went to pass in the House, and it's also headed to the governor's desk. And this is something we're not as concerned about. It's a study committee to look at required vaccinations. And then lastly, in the Senate as well, pretty early on, we were able to work with the Senate to send Senate Bill 374 interim study. It had a lot of concerning actions in this bill regarding vaccinations, COVID vaccinations, other vaccinations. So we were able to also defeat this for the session. So all in all, we had a very effective campaign, and we're again very grateful to the advocates and other organizations who worked with us on these issues. Okay, Jake, do you want to take over from here, and I'll jump in on my bills as well with access to treatment and alcohol and other drugs?
Sure. Thank you very much, Kate. Good morning. My name is Jake Berry. I'm the Vice President of Policy here at New Futures, and I work on our access to treatment policy portfolio. So there were a few priority bills that we tracked throughout the session. I'm proud to say they were all successful in meeting our desired outcomes. To start, I'll begin with House Bill 503. This is a bill that was retained from the 2021 session that proposed to increase access to substance use treatment over telemedicine. Specifically, this bill proposed to eliminate the requirement for an in-person consultation before individuals can access medication-assisted treatment like buprenorphine or naltrexone remotely over telehealth. After a long wait, this bill finally passed the House of Representatives in May. It's now headed to the governor's desk, and we are hopeful that he will sign it into law and really help to eliminate that obstacle for individuals and families in need. Secondly, a parity bill, House Bill 1622. This is a bill that proposed to strengthen our state's parity laws. As you may know, parity is a requirement that insurers cover behavioral health care the same way they do physical health care. This means insurers must cover appointments and treatments the same way and must reimburse at similar rates to physical care. So House Bill 1622, which has now passed both houses of the legislature, writes parity requirements into the state's network adequacy laws. I'm also happy to say there was another parity bill, Senate Bill 373, which is not on our list, but does address a similar topic. It did pass this year, giving the state insurance department greater access to compliance reports that insurers are required to file with the federal government. So this bill has passed both the House and the Senate, and once the governor signs it into law, it will give our state another tool to help strengthen enforcement and ensure compliance with parity laws. Which will give, again, help to better ensure access to substance use and mental health treatment for those in need. So those are some of the priority bills we were watching on our access to treatment side of things. Kate, were there other bills you wanted to touch on?
Sure. For alcohol and other drugs, a lot of our work is usually on the defense, and that was the case this year as well. House Bill 1591 was a bill that would have eliminated the Enforcement Division of the Liquor Commission. The Enforcement Division does really important work as far as licensing and training establishments, as well as making sure that there's no access to alcohol to minors. And so eliminating the entire division just didn't make any sense to New Futures and other organizations who were able to defeat this bill pretty soundly in the House. So we were pleased about that. House Bill 1598. It's a misleading title. It really was a full-on commercialization bill of cannabis. This bill we were opposed to because it did not contain really any of the principles within New Futures principles for responsible commercialization of cannabis, principles around protecting youth, establishing social justice programs, protecting public health, and having public health at the table, and most importantly, having the funding from the revenue from cannabis sales go to prevention, treatment, and recovery. So even though this bill did pass the House, it was defeated in the Senate. And then lastly, actually a positive bill that something we were in support of was Senate Bill 275 that made changes to the Opioid Abatement Trust Fund that has been law for a few years in the state. This is the body and the mechanism for funding, accepting funds from the settlements from opioid manufacturers and ensuring that they are spent in a responsible way. We were supportive of this bill because it did add prevention programs to be included in some of the programs that would be funded through the Opioid Abatement Trust Fund. This passed the House and the Senate and is headed to the governor's desk. Okay, on to children's behavioral health. Emma?
Hi, I'm Emma Savini. I'm the Children's Behavioral Health Policy Coordinator here at New Futures. We also had a pretty successful session, starting off with a big win, House Bill 1431, which establishes the Parental Bill of Rights. We opposed this bill because it would have elevated parents' rights over the rights of the children, which, as we've seen, can be extremely detrimental to kids, especially those exploring their sexual orientation and gender identity. It also would have undermined the important work our state has done in developing and establishing a comprehensive system of care for our kids with behavioral health needs. So this bill was defeated in the House at a vote yesterday, and it will no longer be viable this session, which is great news. Next up, we had Senate Bill 416. Relative to the behavioral health assessment and treatment for children in out-of-home placements. So this bill would have required the state to perform a behavioral health assessment on any child who is at risk for an out-of-home placement when it is clinically advised. So this bill would help kids by ensuring that the treatment they are receiving in any out-of-home placement is directly related to the cause of the problematic behavior that may be related to their out-of-home placement, which has been shown to either shorten the need for an out-of-home placement or eliminate the need for one altogether. So the kids would be able to get treatments that are tailored to their needs and more effective treatment. This bill did pass both the House and the Senate and is headed to the governor's desks, so that's another great win. House Bill 1531 modified the Oversight Commission on Children's Services. So what this bill eventually did was create one large commission that put together the Children's Fatalities Commission and the Grand Families Commission into the Children Oversight Commission on Children's Services. This bill would streamline our effectiveness in essentially making sure that children services are getting to the children in a more effective way. This has passed the House, the Senate, and is also headed to the governor's desk. So that's another great win for us. Senate Bill 444 was another great win for New Futures, both in a collaborative effort between the Children's Behavioral Health portfolio and the Early Childhood portfolio. This bill was relative to childhood adverse experiences, treatment, and prevention, commonly referred to as ACEs. And it did three main things. It expanded access to child-parent psychotherapy. It created a pilot program for children who had experienced ACEs so that they could receive treatment and other services to help create resilience. And then also created a $1 million grant for family resource centers, which are an excellent resource for our communities so that parents and families can ensure that they are getting the supports they need. So again, this bill has passed the House and the Senate and is headed to the governor's desk, and we are really excited about that one. And then finally, House Bill 1639, relative to the Youth Risk Behavior Survey in schools. New Futures opposed this bill. This bill proposed to change the Youth Risk Behavior Survey from an opt-in survey to an opt-out survey, an opt-out survey to an opt-in survey. The Youth Risk Behavior Survey is an excellent tool for our educators in our state Department of Health and Human Services, prevention programs, parents to review public health data and see what children are doing and what healthy choices they are making. It gives children a voice to ask for help when they otherwise might not have one. And so this survey is a really important data collection tool to ensure that our programming is tailored to what kids are experiencing and helps ensure that our programs and prevention tools are most effective. By changing it to an opt-in survey, it would have reduced participation greatly and would have impacted our ability to be effective at preventing unhealthy behaviors in our students. So luckily, this bill did stall in conference committee and is defeated for the session. So we're really proud about that one too. Next up, early childhood.
Great, thanks, Emma. My name is Rebecca Wojtkowski, and I'm the Kids Count Policy Director here at New Futures. Unfortunately, this year was a hard year for early childhood. Right until the end, we had such strong advocacy from our group of advocates, and I'm very thankful for that. And don't be dismayed as I go through these bills. So first up is Senate Bill 144 relative to child care scholarships. This bill directed DHHS to create a pilot program in which billing process was changed from attendance-based to an enrollment-based. This was a policy that was tested during the early days of the pandemic and nationally is known as a strong benefit for both providers and families. Unfortunately, this bill died in the House due to a number of issues. Fortunately, DHHS recently released a report on how they intend to spend discretionary dollars that came through federal funding, and this pilot program is a priority. So we're hopeful that although the bill did not pass, we'll be able to see this policy change in the next budget session. Senate Bill 407 and House Bill 1536 were two parallel bills. These bills aim to expand postpartum Medicaid services for new moms for up to 12 months. Currently, new moms on the Medicaid program lose their insurance after 60 days. We know that the first 12 months after you have a baby are especially vital for the health of both the mother and child. Unfortunately, in the very last second, despite some great efforts from our partners and leadership within the House and Senate, both of these bills and these policies did not pass. Again, we're hopeful that we'll be able to rally our advocates as we approach the next session next year. Senate Bill 446 was a win. This initial bill established a grant program to support the childcare workforce. Through negotiations, it was compromised down to DHHS working with Childcare Advisory to create a plan and submit that plan to Gopher. We are hopeful that that plan will be released in early June and excited to see what sorts of supports are proposed to help our childcare workforce. And the last bill is Senate Bill 453. This bill would have required districts to create pre-kindergarten for all children within our state. Unfortunately, this bill did die early on in the session. So despite having a couple of hard losses here, we are still happy that there was some attention and effort to ensuring that we were making the appropriate investments in our early childhood system. And with that, we'll move on to health policy.
Thank you, Rebecca. So for our priority healthcare bills this session, I'm again proud to report mostly positive outcomes. Starting with House Bill 103 and Senate Bill 422. Again, these are parallel bills that propose to extend Medicaid coverage to dental services. This has been a years-long effort in the state, and I'm really thrilled and proud to report that both of these bills did pass both houses of the legislature and are headed to the governor's desk, where he has pledged to sign at least one of them into law. So going forward, our state will have a Medicaid dental benefit for individuals and families in need. We all know that oral health care is a critical part of overall health care. And so this benefit it really is a big deal and a big win for our state, thanks to all those advocates and partners who have been working for so many years to make this happen. I wish I could report similar success with Senate Bill 399 and Senate Bill 434. These two bills did initially propose to repeal the 24-week abortion ban that was put into effect at the beginning of this year. Sadly, both these bills were defeated early on in the session, but there is some positive news to report. There was another bill, I believe House Bill 1609, if I'm not mistaken, that did pass and is headed to the governor's desk that would, among other things, it would create an exemption for fetal viability, which so it would allow abortions in cases where the fetus will not carry to term. And in addition, it does repeal the invasive ultrasound that was required prior to all abortions. It does make greater exemptions for that. So that is some good news in regards to reproductive health. House Bill 1028, this is a bill that we strongly oppose that would have made permanent short-term insurance plans that are high cost and low coverage. These plans, in our view, are really just not helpful, do not provide adequate coverage, and do lead to large out-of-pocket costs for individuals. This bill proposed to make these short-term plans to allow for unlimited renewals, so it's essentially to allow them to be permanent, which really would have been detrimental to the marketplace. That bill fortunately was defeated earlier on in the House session. And then lastly, there's House Bill 1526. This is related to the In and Out Medical Assistance Program. This is the In and Out program provides coverage for individuals who meet most of the qualifications for Medicaid, but make a little bit too much money to meet the income restrictions. So this bill does increase the eligibility, income eligibility for the In and Out program, which will allow more people to qualify, and so they'll be able to get to maintain health coverage even during fluctuations in their insurance. So that's a very good thing. And that bill did pass both the House and Senate and is headed to the governor's desk for his signature. So all in all, I'll say on the healthcare front, it was mostly a good session. Thank you again for all of your tremendous advocacy. And next up, I think we have some equity and advocacy bills, and here we'll see a few more sort of mixed results. There was Senate Bill 304 and House Bill 1576 initially proposed to repeal the divisive concept language that was passed as part of last year's budget. You'll recall that, that this budget provision was going to ban discussion or teaching of so-called divisive concepts in schools, divisive concepts including race, gender, and sexual orientation. We certainly think that discussions and teaching of some of these issues are absolutely an essential part of both children's education and an essential part of supporting diversity, equity, and inclusion in our state. So we strongly supported these bills which proposed to repeal that language. Sadly, both of them died early on in the session. On the good side of things, House Bill 1313, this was a bill that proposed to extend that divisive concept ban to colleges and universities. Thankfully, that bill was also defeated early on in the House, so was not able to pass this year. And lastly, on the advocacy front, there was a bill that we strongly supported, House Bill 1014, that would have allowed public meetings to be conducted virtually during the pandemic. We saw at the state and local level, one of the positives of the pandemic was increasing access to public meetings. Many more individuals were able to, over Zoom or other teleconferencing programs, were able to attend and make their voices heard at public meetings on a variety of issues. We know that as the public emergency went away, that virtual access was eliminated at the state level and in many towns. House Bill 1014 would have allowed all towns to conduct their public meetings virtually or have a virtual option. Sadly, that bill was defeated early on in the House, so we will be looking to revisit that next year and see if we can continue to push for this level of advocacy. And so I think that is where we stand now. Martha, do you want to close this out?
Sure. So, so we do have some next steps for you. We have House Bill 1606, which we would really appreciate your help in urging the governor to veto this bill. This would make the state vaccine registry an opt-in program. And as you heard, we're better off with an opt-out program. Then I also just want to thank Rebecca, Kate, Jake, and Emma for leading these efforts during the session. And thank all of you for joining us and for your effective work this past session that led to all of our successes. I mean, we did have some challenges, but the efforts are never wasted. I mean, our efforts provide education for policymakers, and they often open up other ways to achieve the outcomes that we're looking for. I think you heard some of that today as well. So you're all incredible advocates, and New Futures really appreciates you. It's been amazing to watch the work that was done this session. If you are interested in getting involved in the work of New Futures and you don't currently receive our action alerts, please go to our website and you can sign up for those emails. And have a great rest of your day.